The risk that people talk about during breast augmentation is infection. Now, infection can happen with any surgery. Anything where we cut the skin gives a higher risk of having an infection. And even without cutting the skin, patients get an infection in their skin or on their body. It's something that can happen anytime. Surgery does increase the risk of this. Most of the infections are caused by bacteria that are living on our bodies already. And surgery weakens your body so that the risk of infection is higher. In the case of breast augmentation, infection is difficult to deal with because we're putting a man-made and artificial object into the body, and any bacteria that gets onto that surface can't really be completely eradicated like it can be when that infection is part of our body. The infection almost sticks to the implant and can be difficult for the infection to go away. So for this reason, we want to be extremely careful when we do any sort of breast augmentation surgery involving an implant because you are at higher risk of infection. For whatever reason, when you place an implant through an armpit incision, the risk of infection is much, much lower. I don't know exactly why that is, but in my experience and also comparing my results to the literature, meaning other series, other groups of patients done by other surgeons, we find that the risk of infection is extremely low, less than 1%. I theorize that there's a couple reasons for this. One is that there are bacteria that live in the breast, both beside the areola, underneath the areola, in the tiny little tubes that are designed to drain the milk from the breast into the nipple. And those bacteria can very easily get onto the implant surface if the breast implant is placed through the breast, either incision beside the areola or incision underneath the breast. The breast isn't completely what we call sterile. There are bacteria there, and that exposure of that bacteria to the implant increases the risk for infection, in my opinion. The other reason is that the distance from the incision to the implant is much shorter with the breast incision, especially the incision underneath the breast. Sometimes that distance from the skin, the surface of the skin where a lot of bacteria live, to the implant only can be about this much, just less than an inch or so, very short distance. And again, that closeness between the skin surface and the implant, I feel, increases the risk of infection. When going through an armpit incision, sometimes that distance can be this long from the incision to the implant. So again, a longer distance is going to be safer to try to prevent that bacteria from the surface of the skin getting to the implant surface, where it can be more dangerous and increase the risk of infection. So with any surgical procedure, you want to be able to talk to your surgeon and feel comfortable with the decisions that they're making about what they're going to do to your body. So the first thing is that the patient should be completely comfortable with how the surgeon thinks about how you should look. So I would make sure that you choose a surgeon that listens to you, knows what you want, has experience, and the before and after images in their resume or their experience that show you results that you like. But on the other side, the actual surgery has to be done properly. So the problems that I've illustrated, that I talked to you about today, are things that a surgeon should be thinking of preventing when they do your surgery. And it's worthwhile to address some of these concerns with your surgeon to make sure that so he or she can do their best to try to decrease the risk of any of these things happening to you in surgery or after surgery. If you are considering breast augmentation, I hope you like this video. These are all important things that I've learned in my practice over the last 20 years that I should be considering and a patient should be considering before going into surgery. Please leave any comments that you have down below. Smash the like button, subscribe to this channel if you like this content, and we'll see you next time.